There are many horror stories to be shared about extremely long wait times in Canadian emergency rooms, but there aren't many explanations as to why. Is it lack of doctors, too many patients, misuse of the system, or simply not enough funding? Most importantly, what is the effect on the quality of care patients are receiving and their overall healthcare experience? There's no question that wait times are long. On average, waiting to be seen by a doctor can take 3 to 4 hours. Are Canadians really that sick, or is there more to the story? Looking at some available facts, we can see some trends that may shed light on this concerning issue. Statistics show that between 2014 and 2015, 660,000 patients who had visited the emergency room had what's called a CTAS level of 5, which means that the visit was non-urgent or routine. This accounts for 46% of emergency room visits. Non-urgent complaints include common colds, pink eye, or an uncomplicated urinary tract infection, for example. Our Canadian healthcare system offers so many options for receiving care, including walk-in clinics, family physicians, after-hours urgent care clinics, or 24-hour advice through telehealth. A survey revealed 7%, over 45,000 patients, said they had visited the ER for a non-urgent issue because they simply didn't know there were other options available to them. The large number of patients in our hospitals can affect the care that everyone receives. If a limited number of rooms and beds are filled, patients can be left on stretchers in halls and common areas for hours. Wait times are extremely long, and the cost to our healthcare system is increased. Ontario currently spends 41% of its budget on OHIP every year. Canada-wide, healthcare accounts for 11% of our GDP. The cost of a resident in Ontario to see a doctor in the emergency room is $502.50 alone. If this funding is going towards minor complaints that could be addressed or treated with over-the-counter pharmaceuticals or by visiting in an alternate facility, the cost could be greatly reduced. Possible suggestions include implementing an education program in our high schools that makes students aware of where our health funding comes from and how the system works and what their options are. Another solution could be the introduction of a small copay fee per visit, or for visits that are not considered medically necessary by a physician. Although these are relatively small fixes, it may just be enough to begin reducing waiting times and overall increase the quality of care delivered to our patients.